Hello, I'm Donald Walker, and I'm Communications Director for Brevard County Government. I'm joined here today by Public Safety Director Matt Wallace, by the Florida Department of Health Brevard Administrator Maria Stahl, Interim Emergency Management Director John Scott, and Brevard County Fire Rescue Chief Mark Schulmeyer. We're here to provide an update on the COVID-19 cases in Brevard County and to provide information on the actions the county is taking to assist our residents. First off, let me start with personal protection equipment. We had a grant program several weeks ago where small businesses and nonprofits in the county could apply for free personal protection equipment from the county. That application period ended, and we still had quite a bit of PPE left over, so we have reopened the process for small businesses to obtain PPE, and you no longer have to apply for it. So, if you are a small business in need of personal protection equipment, we will have free supplies available at the Brevard County Government Warehouse, which is located at 7740 Technology Drive in West Melbourne, from 10 a.m. to 3 p.m. daily, Monday through Friday. We are requesting, if you want to come pick PPE up there, that you call in advance and make an appointment. And that number is 321-637-6680. Also, for small businesses that need PPE, we are having a distribution site set up August 27th from 11 a.m. to 3 p.m. at the Catherine Schweinsberg Road Central Library, which is on Forest Avenue in Cocoa. So no applications are required, and businesses will not be required to show a business license to receive a PPE kit. Each kit contains 200 procedure masks, 25 reusable cloth masks, 2 boxes of gloves, and 2 bottles of hand sanitizer. And again, there is no charge for that. On another level, we have food assistance that's available for residents who have been financially impacted by COVID-19. And there are 2 opportunities this week to get some food assistance from the county. First of all, we have a farmer's market on Thursday evening at the Wickham Community Center, the Wickham Park Community Center, my apologies. That's at 2500 Parkway Drive in Melbourne. And then also on Friday, and that's from 3 to 6 p.m., sorry. And then on Friday, August 14th, at the Welcome Center at 419 South Hopkins Avenue in Titusville, we will have food assistance available. That's through the UF Brevard Extension Service. And individuals can obtain $50 in CARES Act dollars, basically in the form of tokens, that you can use to purchase vegetables, fruits, honey, coffee, eggs, herbs, and other items that are available at that market. The markets are open to all residents. Those who have been financially impacted by COVID-19 will be eligible for the CARES Act tokens upon completion of a self-declaration form that will be available on site. A photo ID will be required with matching address on that self-declaration form. Also at both sites, there will be Supplemental Nutritional Assistance Program, SNAP, available. So I just wanted to inform you of those, and I will address later in this update where you can get other information on these programs if you need assistance. On that note, I'm going to turn it over to Matt Wallace, our Public Safety Director, for some additional updates. Matt?
Thank you, Don. Good morning, Brevard County. I am Matthew Wallace, your Public Safety Director for the county, and I'd just like to give a few words here on some updates and kind of just talk about where we are. Before we get into that, I just want to thank you again, Brevard County, for tuning in and being part of this and getting the information so you can make appropriate decisions for your loved ones and your families. We will get through this. We will get through this together, and we'll get through it as a team. As we continue to share information and do the right things at the right time, we'll no doubt be successful. So it's been a long journey this far. We've made it since February to where we are today, and we will continue to be strong. We will continue to get the information out. We will continue to work together as a county and as a community. I have no doubt. I'm excited to talk about some of the individual programs that we have for individuals and businesses in the county. And I'd just like to give a quick update on where those are and just some processes and some data for y'all to make good decisions. Some of the programs we have is the Individual Assistance Program, the Food Stability Program that Don mentioned earlier, our Small Business Nonprofit Economic Relief Program that we have underway, as well as our Workforce Recovery Program. Additionally, program was the Personal Protective Equipment Program that Don mentioned earlier. I won't get into much detail about that one. At the start is our Individual Assistance Program, and that is for our residents for rental and mortgage relief, utilities, and security deposits. So if you find yourself in need for assistance in any of those areas, we are taking applications at all county libraries throughout the county, or by mail or hand delivery to the Housing and Human Services Department, which is here in the Viera Government Center at 2725 Judge Fran Jamieson Way. It's Building B, Suite 103 here in Viera. So just come on by and we'll make sure we take care of you through the application process. For the Individual Assistance Program, some of the statistics that we have already, we have about 711 applications that we've received, and we've obligated over $1.6 million back out to the community for this program. So we're very excited about that, and we will continue to push those dollars out to the community as quick as we can. The second is the Food Stability Program that Don had mentioned earlier. Just a little bit more information about that is we're using those monies to backfill pantries and food banks and supporting any type of pop-up pantry that we have. The goal obviously is to get food to those who need it throughout the county and to make sure that we target our residents who are in need. We do support the weekend meals program that Don had talked about at the farmers market on Wickham Park, and we're very, very excited to be opening up a second one up in Titusville. Just some individual statistics about the food program is we've served over 21,000 meals so far, which is an outstanding effort, and we've reached over 1,000 households. So we'll continue to push that program out. We'll continue to advertise it. We'll continue to get the details. If you have any questions, please at the end of this Facebook Live, shoot us those questions or get in touch with us at brevardcountyfl.gov or our phone numbers. The next program I'd like to talk just briefly about is our Small Business Nonprofit Economic Relief Program. That's open for all small businesses and nonprofits in the county. The program was initially supposed to be stopped or have a deadline of August 10th, but we now have open enrollment. We've extended that deadline indefinitely. We currently have open enrollment online. So if your businesses need help, your nonprofits need help, look for us on brevardfl.gov to fill out the application and be part of that program. Some of the eligibility requirements for the program include to be physically located in Brevard County, to have 50 or fewer employees as of 1 January of 2020, to have been financially impacted by COVID-19, and must be disclosed that you have must disclose if you have accepted relief from prior programs. An online application only. If you have questions, Don, do you have the phone number for that if they have questions for the Economic Relief Program?
Yeah, it's 350-9194.
9194. So again, call us and look for it on the website that was just up on your screen if you're interested in applying for that program. Final program I'd like to talk about is the Brevard Recovery Program, also found on brevardfl.gov/Brevard Cares. This is a partnership with Career Source Brevard to assist small business and nonprofit organizations that had employee issues. We'll provide staffing support and to try to get you the manning and people that you need to help you run your businesses. Again, look for us on that website. There's a ton of information out there. There's a ton of statistics and there's a ton of help, frequently asked questions, contact information. It's all there on that brevardfl.gov/Brevard Cares. Don, that gets me to the end of my talking portion. Again, Brevard County, thank you for joining us. Thank you for tuning in. We will make it. We'll make it together, no doubt. Don?
So now I'm going to turn it over to Maria Stahl, who is the administrator of the Florida Department of Health Brevard office, and for an update on COVID-19. Maria?
Okay, thank you, Don, and good morning, everyone. My name again is Maria Stahl, and I'm the Health Officer Administrator at the Florida Department of Health in Brevard County. As of this morning, we reported out a little over 6,300 cases, and that is an increase of 63 cases from yesterday. Our labs reported out today at a 4% positivity rate. Overall, our labs have been a 7% positivity rate. We've totally done in Brevard County 85,551 labs, and that's between us and all of our partners, which John will talk a little bit about when he talks. 17% of our population to date has been tested. Our deaths, we have 163 deaths, and unfortunately, we added 3 additional deaths today. 98 of those deaths are associated with long-term care facilities. We've had 346 pediatric cases amongst those cases, and that's from 0 to age 18. Our hospitals are very stable. Our hospitals are busy, but very stable. They've been running between 20 to 25% capacity for both their hospitals and their ICU. Currently, our priorities continue to be testing and protecting the vulnerable populations, and that includes our pediatric population in our state. The range of labs over the positivity rate in a rolling average, 7-day average, has been running right about 5 to 5.5%, which is very good compared to the rest of the state. To give a comparison, over the last 2 weeks, we've added 978 cases. That's a little bit better than we had been running in July. The staff in long-term care facilities continue to be tested every 2 weeks. And additionally, what is happening is the regional teams are going into all 163 of our long-term care facilities to do infection control visits. I just wanted to reiterate, with school starting, where parents can take their children for pediatric testing. At our Viera clinic, we are doing pediatric testing for any age, so pediatrics as well as adults. The number to call for an appointment there is 321-454-7141. The other places that are doing pediatric testing is Eastern Florida State College. They're doing pediatrics over the age of 5. Omni Healthcare is doing their testing at the facilities where they're testing over the age of 2. Many urgent cares are doing the pediatric testing. There are some pediatricians' offices that are also doing testing, and Brevard Health Alliance is doing testing for their pediatric population. But I want to reiterate, with pediatric testing, your first line should be contacting your pediatrician to see, does your pediatrician agree that testing should be done? The other thing I did want to mention outside of COVID is immunizations and the importance of having your children up to date with their immunizations for the start of school. Currently, we are down by 75% with children coming in to receive their vaccines. Only 34% of our incoming kindergartners have the required vaccines. So that is very important. We do offer free vaccines at our 3 clinic locations in Titusville, Viera, and Melbourne on a walk-in basis, Monday through Friday, 8 to 4, or you can get the vaccines through your pediatrician's office. So I want to end again with our message. The most important thing is staying home if you're sick. As school starts, your children should stay home if they're sick. You should stay home from work if you're sick, and you shouldn't go out in public places if you're sick. Masks are very important when you're out in public places and you can't maintain your social distancing. Hand hygiene, wash your hands frequently. Avoid crowds and avoid closed spaces as much as possible. Thank you.
Thank you, Maria. So John Scott, who is our interim emergency management director, has some additional information on testing, but also John is going to give us an update on hurricane season. We just recently had a brush with tropical storm, And John, if you would mind, give us an update.
Thank you, Don. Good morning. Again, I'm John Scott. I'm the Interim Emergency Management Director for Brevard County. Maria gave a very thorough brief on options available, especially for children in the county. I'll touch on some additional options that we've partnered with here at the county. The state partnership we have with Eastern Florida State College in Palm Bay continues to go very well. As a reminder, that is a no appointment necessary drive-through testing site. It's open 7 days a week from 9 to 5. They are testing, as Maria said, pediatric folks 5 and up with parental consent. And we're also very excited to announce that they have started the antibody testing there. So if that's something you're interested in, that opened late yesterday and is now operational today. Just as a reminder, that is for folks who are 18 and up, and that is a blood draw, so just be prepared on those kinds of things. But it moves through pretty quickly. That continues to be a tremendous asset. And again, if you need a test, you can drive down there and get it anytime, again, between those 9 to 5 hours. We've also partnered with a couple of our hospitals. In the north end, we've partnered with Parrish, where if you need a test, you can call 321-268-6139 to partner with Parrish and get a test through them. Or if you're on a barrier island or in Merritt Island, we partnered with Health First. You can call them at 321-434-3131 to schedule an appointment. Maria is testing in Vieira at the health clinic, and as she touched on, many urgent care centers, doctor's office, and pediatricians are continuing to add testing capabilities. So always contact your primary care physician when exploring those kinds of things. So that's sort of where we are testing-wise. I think that gives us good coverage from north to south as much as we can. I'll talk a little bit about what was hurricane, then tropical storm Isaias that we saw a couple weeks ago. It was an excellent reminder that we are entering in the peak hurricane season, which again runs from August to October. That's really when we see the most activity, especially in September and October. So we still got a ways to go with the season on what has been a very active season so far. Josephine just got named today. She's out there. Fortunately, it doesn't look like she's going to bother us or really anyone. It's going to continue to just sort of move out to sea. But it really is, and hopefully Isaias was a good reminder to everyone, like now is the time to make sure that you have a disaster supply kit. You and your family have an emergency plan on where you're going to go. We talk about it all the time. It's nice to have an idea, and it's good to have a conversation with where you're going to go with your family, but it's even better to write that down. Once you write it down, it really cements, okay, this is what we're going to do in the event of a storm. This is how we're going to handle our evacuations, our sheltering, what our needs are, and where we're going to go. I also want to use this opportunity to remind people, when we talk about storms for evacuations, and people are certainly very cognizant of the impacts COVID have on our hurricane season this year, if you live somewhere that's outside of an evacuation zone, so when we talk about evacuation zones, we're talking about barrier islands for storm surge issues, we're talking about low-lying or flood-prone areas, we're talking about individuals that live in mobile and manufactured homes just because of their structures' vulnerability to higher winds. And we're talking about people who have special medical needs. Maybe you rely on power or water to maintain your health. So those are the folks we're talking about, and those are the folks we're really targeting when we talk about evacuations. If you don't find yourself in that group, then you don't have to evacuate. And that's an important part this year. So if you live in a good, strong structure, maybe you've done things like you've got plywood or storm shutters, you've got a generator, you've taken all the steps that we strongly encourage to harden your home, and we want you to stay where you are there. But if that's not you, if you are someone in that evacuation group, then absolutely please evacuate. Please, listen to us for local responses and local direction, because regardless of the pandemic, and I keep saying it during these things, tropical storms and hurricanes don't care about a pandemic. They're still going to come if that's the way the weather says, and we have to be prepared and act accordingly. So those are all good messages. I was really proud of how we responded, both as a community and a first responder community to Isaias. I think we learned some small lessons there that we can continue to tweak our programs. And, we're all learning things as it comes to COVID and hurricanes, so we continue to make great strides there. Don?
Thank you, John. And just continuing briefly with the hurricane theme, I know during the tropical storm, we saw a lot of residents put up shutters, and we start getting questions immediately once the storm passes. How long can I keep my shutters up, or my neighbor's shutters are still up on their house? How long can they keep those up there? So we have Chief Mark Schellmeyer here today. Chief, what can you tell us about things about shutters and other hurricane important messages?
Yeah, so we're about 7 to 8 months into a global pandemic, and of course, Isaias reminded us that hurricane season is upon us, and then so each year we get a couple of questions and concerns, like Don had said, in regards to storm shutters and generator safety as well. And so with storm shutters, people generally put them up during the threat of a storm, and sometimes you get complaints that, hey, my neighbors had their storm shutters up since June 1st. What's the rules and regulations that govern storm shutters? And so in our Code of Ordinances, and I apologize for reading it directly, but Section 22-278, Maintenance Standards and Requirements, Section 9, storm shutters, windows and doors in occupied dwelling units shall not be boarded or covered except for the temporary installation or closure of storm shutters, panels, or other hurricane protection devices during the threat of a storm. While such protection is provided, at least one door leading directly to the building exterior shall be provided. And so a lot of people will argue that during the threat of a storm, well, Florida is under the threat of a storm for 6 months out of the year. And so they tend to use that as their loophole to leave them up all year. But the important thing is that once that storm has passed, is to take them down, and at least at a bare minimum, take away the covering from your primary means of egress and your secondary means of ingress and egress. We do realize that we have a large elderly population and some disabled folks that generally pay people to put those shutters up and take them down, or rely on the goodness of their neighbors' hearts to do the same, and sometimes that may get delayed. And so, we're not too terribly concerned about those people, but we are concerned about, in case of a fire, what leaving those hurricane shutters will do in terms of people not being able to get out. And also, those shutters can be problematic for firefighters as well, responding to. If you do have a fire, you can't get out of those buildings, but also we can't get in as well. We do have methods and techniques to deal with those shutters, but they are time-consuming, and time matters in the event of a fire. We also get concerns about generator safety, and each year, whenever we have a storm event, we have people that lose power and run their generators, and the biggest threat is carbon monoxide poisoning. I almost feel sad that I even have to mention it, but please don't run your generators inside the house. We do every single year. We have people that put their generators in their garage for security reasons. They close the garage door, leave the generator running, and then they pollute the home with carbon monoxide, which can be deadly in certain doses. The other thing we have an issue with is fueling your generator when it's hot. Don't fuel a generator right when it's hot. Don't pour gasoline onto hot surfaces like exhaust. That can lead to fire, flash burns, hospitalizations, and even death. The other thing is plugging. A lot of people tend to backfeed their generators into a dryer plug, and so that can be problematic for crews that are restoring power in the area, because when you backfeed power through your home, it also backfeeds power through the power distribution system and can shock and kill workers downrange from your home. And so those are the biggest items. Carbon monoxide, flash fires, and of course backfeeding the power. There's plenty more if you want. There's tons of resources online, even FP&L, and some sites, some websites have information on generator safety. And that's all I have.
All right, thank you, Chief. So Brevard County's Emergency Operations Center is one of the most activated EOCs in the nation, and one of the reasons for that, along with pandemics and hurricanes, is rocket launches. And we've got some pretty high-profile launches coming up, and I'm going to turn it back over to John Scott to talk about those. John?
Yeah, I'll briefly touch on sort of where we are with launches for the year. Launch operations have continued throughout the pandemic, and a lot of our space partners have really taken great strides to make sure they're doing that as safely as possible. Just this past summer, we saw the return to human spaceflight. And we also saw the Mars Perseverance launch, was that 2 weeks ago, right before Isaias, again, launching the Perseverance rover to Mars, and we continue to explore that mission. We do right now have In addition to our regular launches, which we see a couple a month right now, we are getting ready for the next, sort of the next human spaceflight mission, which right now is slated for the end of August, start of September. A firm date hasn't been locked in yet, but they continue to prepare for that, and we continue to learn lessons from our past operations. We saw a good influx of visitors, obviously, with the historic return to human spaceflight. We expect that to continue to be the trend as more and more folks want to come back and see us continue to put humans in space. So we'll continue to work with our partners and make sure we're as prepared as possible to not only deal with any sort of COVID issues that come out of it, but also just your general traffic safety issues, making sure folks are there. And obviously, it's still in the middle of hurricane season, so we have to make sure we are able to adjust to that as well.
Thank you, John. So during this Facebook Live event today, we've had our social media specialist, Jesse Ray, monitoring questions, and we're going to take some of those right now. Jesse, what do we got?
Thanks, Don. So as Don said, I'm Jesse Ray. I'm the social media and communication specialist. We did have a question come in, and this one's going to be from Maria. So Brevard County has the third most highest deaths in Central Florida, and it's growing. At least 28 since last Wednesday. Why are those deaths quickly increasing, and why are people dying?
What I can say is, again, Brevard County has a population of close to 600,000. Of those, 25% are over the age of 65. If you look at the deaths statewide, there's a larger number of deaths over the age of 65, and that truly is the case also in Brevard County. As I had stated, there were 98 of our deaths that are associated with long-term care facilities. And if you look at our long-term care facilities, we have 168 in Brevard County. And that is the most vulnerable of vulnerable population.
Okay. Is there anything that can be done to bring down the death rate?
I think at this point we're doing the mitigation measures that are being taken. We do have the regional state teams that continue to go into the long-term care facilities. Whenever we have a case associated with the long-term care facilities, not only is our EPI team involved and go out to do a visit, but very frequently ACA, who is the regulatory authority, also goes out, and the state regional team goes out. And you know, like I said earlier, every 2 weeks, every 2 weeks, the staff does need to be tested, because we do know the staff is members of the community. They are out in the community. But in addition to that, the state has also had the regional teams specifically go out to all long-term care facilities in our region to do infection control visits.
Okay, thank you. I would like to preface really quickly that there is about a 20 to 30 second delay. So for those of you who are sending in questions on Facebook, just give it a couple of seconds, and I promise we will get to you. So Maria, back to you. So the hospitals, what is being done to ensure that hospitals are not overwhelmed with COVID patients, and where do we stand with our hospital capacity right now?
Okay. As I stated, our hospital capacity has been very stable and doing very well. We're running between a 20 to 25% hospital bed capacity, and we're running a 20 to 25% ICU bed capacity. We at the health department, along with emergency management, are participating in once or twice a week calls with the hospitals, and actually talking to them more frequently than that if need be, to discuss what's actually going on in their facilities. There are surge plans in place. Also, they have the ability to convert the regular rooms into negative pressure rooms as needed. There's also a cooperative spirit amongst all the hospitals that if one reached capacity, the other one would pick up and help out. So, but through the whole pandemic, our hospitals have not been to the point where they have been overrun or out of beds.
Okay. So far, this is the last question for you. How does the contact tracing work here in Brevard County?
Okay, the contact tracing, our epidemiology staff, when they get a positive case, and remember when I say a positive case, sometimes it is a little, it is a little delayed from when the lab reports out. The point in time, the rapid tests do take even longer to report out because they go up to the state level and then come back down. But as I say that, when a case is reported and identified by our epidemiology, the attempt is made to contact the individual. When the contact is made, and we do attempt 4 times to get a hold of the individual, when they reach the individual, they do an investigation and interview. And at that time, they identify close household contacts, other close contacts, where they work, do they work in a high-risk area, and then we take it from there.
Okay, thank you, Maria. John, we did have one person that wanted you to repeat the Palm Bay information. I'm not sure if they just meant antibody testing, but let's go over COVID and antibody, if you wouldn't mind.
Sure. So again, at Palm Bay, Eastern Florida State campus, Eastern Florida State College campus in Palm Bay is running 7 days a week, 9 to 5. The antibody test is available there along with the regular, what is called the PCR test. That's the traditional COVID test. Both are available there. The antibody test, you get your own lane. It is a blood draw. They'll draw your blood and then get back to you with the results.
Okay, thank you. And Don, we have quite a few comments about mandating masks, and I know this is something that the Board of County Commissioners has covered before. Is there any talk of a reconsideration of the mask mandate? Can you talk on that a little bit?
Well, I can tell you that the Commission Chair, Brian Lober, has twice come to his fellow commissioners seeking a mandatory mask requirement, and both times that failed for a second. So I think what our county commissioners are simply doing is just asking people to follow CDC recommendations, which is to wear a mask. But they realize there may be certain circumstances or conditions involved where people can't or shouldn't be wearing a mask. Like you can't wear a mask if you're eating in a restaurant, but you can wear a mask when you walk into the restaurant, kind of thing. I think they're just leaving that up to personal responsibility.
Okay, thank you. That was really all of the questions that I had. I wanted to just give it a couple more seconds. I sent a quick message asking if there were any other questions, and I just wanted to give them a couple seconds. It doesn't look like we have any other questions coming through, so that's all that I have for today.
Okay, so if you would like to get information on what we talked about today or just day-to-day updates, you can follow us on Facebook at Brevard County Government or Brevard County Emergency Management. We're also on Twitter, and that would be at Brevard EOC and at Brevard CO_FL. We're also on YouTube. You can watch us again today if you'd like to at SCGTV 499. You can also go to the website www.embrevard.com. And finally, any questions that you have related to assistance or the pandemic itself, 211 Brevard can field those calls and make sure you get to the right place to get the assistance or the information that you need by simply dialing 211 on your phone. And that's it for today. Thank you very much for tuning in.
Thank you.